The anterior triangle of the neck. This is our study guide, and I hope that going through this lecture slide, we should be able to describe the anterior triangle, where the anterior triangle is located, the boundaries of the anterior triangle, its subdivision. This means that the anterior triangle is subdivided into a number of triangles, which we would see during the course of this lecture, the contents of the subdivisions, and also clinical relevance. The anterior triangle is a triangular space that is located in the front of the neck. It is a paired triangle, which means that we have one on the right and one on the left. Before we go deep into this lecture, it is good for us to draw a four-sided outline in the lateral side of the neck so that we can see specifically which region the anterior triangle lies. Imaginary line extending from the angle of the mandible to the mastoid process behind. Then you have an inferior border drawn along the upper border of the clavicle. The anterior border of this four-sided presentation will be along the anterior midline plane of the neck, and we have the posterior boundary as the anterior margin of the trapezius muscle. So this is a four-sided presentation, and this is seen better when the neck is tilted to one side. So let's go further to see where the anterior triangle is specifically located within this four-sided outline that is drawn on the lateral side of the neck. We then have the sternocleidomastoid muscle dividing this four-sided outline into two. So it runs along its diagonal, dividing it into an anterior triangular space and a posterior triangular space. We already know that the sternocleidomastoid muscle originates from the mastoid process of the temporal bone, and its insertion points are on two regions. The first insertion is on the sternum, while the second insertion point is on the medial 1/3 of the clavicle. And that is why we have the name sternocleidomastoid. So this sternocleidomastoid muscle tends to divide this four-sided outline into two, thereby giving an anterior triangular space, which is located anterior to the sternocleidomastoid, and this is the anterior triangle. Then we have another triangular space behind the sternocleidomastoid, which is the posterior triangle. You can go and check up our lecture on the posterior triangle of the neck, but for the purpose of this lecture, we would be limiting this class to the anterior triangle of the neck. The boundaries of the anterior triangle would then be superiorly by an imaginary line that extends from the mandible to the mastoid process of the temporal bone. Then we have medially an imaginary midline plane of the neck, which is a line that is drawn along the anterior midline plane of the neck. Then laterally, we have the anterior border of the sternocleidomastoid muscle. So this is the sternocleidomastoid, this is the anterior border, and this is the posterior border. So the anterior border of the sternocleidomastoid forms the lateral wall of the anterior triangle. You can see that a triangular space is now formed, but anterior to the sternocleidomastoid muscle. So this is the anterior triangle. This anterior triangle is further subdivided into sub-triangles. But before we go into the subdivisions of the anterior triangle, it is good for us to look at two muscles. The first one is the digastric muscle, and the second one is the omohyoid muscle. But specifically, we'll be looking at the superior belly of the omohyoid muscle. So let's continue with this. The digastric muscle is a muscle that extends from the mastoid process of temporal bone to the symphysis meti of the mandible, which is the chain. It presents a form of curvature. So it runs from the mastoid, runs to be attached on the hyoid bones, which is on its greater cornu. From there, it now runs forward to be attached on the chain. This now leaves the digastric muscle with two bellies. So it has an anterior belly, and this is the anterior belly, which is the belly that runs from the hyoid bone to the symphysis meti in the anterior side. Then a posterior belly, which is the region that runs from the hyoid bone to the mastoid process. Between the intercept of these two bellies, we have an intermediate tendon that forms attachment on the hyoid bone, creating an intercept between the posterior belly and the anterior belly. Then the second muscle we'll look into is the omohyoid. It runs from the hyoid bone to the scapular notch posteriorly. We've talked about this muscle during our lecture on the posterior triangle. This muscle runs in the same pattern as the digastric. It has an interception that is formed by a tendon, and this tendon divides the muscle into a superior belly and an inferior belly. So the superior belly originates from the hyoid bone to the intermediate tendon, while the inferior belly begins from the intermediate tendon to be attached posteriorly to the scapula. But point of interest is the superior belly, because it is the superior belly that runs within the anterior triangle. The posterior belly, we've talked about it during our lecture on the posterior triangle, that divides the posterior triangle into the occipital triangle and the supraclavicular triangle, or the subclavian triangle. So we'll be focusing on the superior belly of the omohyoid and also the anterior and the posterior belly of the digastric muscle. So looking at the configuration of these two muscles, we are able to divide the anterior triangle into the subs that they are made up of. This is the superior belly of the omohyoid muscle. So the subdivisions now, the first one we will look at is the submental triangle. The submental triangle is an unpaired triangle, which means that you only have one of it. Then the second one is the submandibular. The submandibular is below the mandible, is a paired triangle, which means that you have one on the right and one on the left. The next triangle is the carotid, which is also paired, and also we have the muscular triangle, which is also paired. That means we have one on the right and one on the left. This is the configuration of the anterior triangle. Let's take it again. An imaginary line that is drawn from the symphysis meaty to the mastoid process of temporal bone. Then we have the anterior border of the sternocleidomastoid. Then finally, to complete the triangular space, we have the anterior midline plane of the neck. So this is the entire configuration of the anterior triangle. This is the digastric muscle. Then this is the superior belly of the omohyoid muscle. So if you bring back the view of this muscle, as we explained in our previous slide, you can see that this triangle is now further subdivided into 4 sub-triangles, and this is the submental. Submental, we already said that it is unpaired. That means it's just one triangular space. This is like half region of the submental triangle. The other half is on the other side, which cannot be seen in this image. Then the next one, the submandibular, which of course is seen below the mandible. We have the carotid triangle. Then we have the muscular triangle, which is the 4th one. So we would take this triangle one after the other to see their boundaries and also what they contain. So the first one is the submental. We already said that it's an unpaired type of triangle. The boundaries will include laterally. We have the anterior bellies of the digastric muscle. This is the right anterior belly of the digastric muscle of one side. This anterior belly we also have on the other side. The 2 anterior bellies will form the lateral boundaries. So this is one of them. The second one is imaginary. It's going to be on the other side. It's still the anterior belly of the digastric, but on the other side of the face. Then we have the base formed by the upper border of the hyoid bone. So this is a triangular space that is formed below the chain. The next one is the submandibular triangle. It is a pair type of triangle. That means it is located one on the right and one on the left. It is located behind the submental triangle. The boundaries, we have the base formed by an imaginary line drawn from the mastoid process to the angle of the mandible. And we have the posterior border formed by the anterior border of the posterior belly of the digastric muscle, while we have the anterior border formed by the posterior border of the anterior belly of the digastric muscle. So we now have the 3-sided configuration formed, and this is termed the submandibular triangle. The next triangle is the carotid triangle. The carotid triangle is also paired, which means we have one on the right and one on the left. The boundaries, the upper border of this triangle is formed by the superior belly of the omohyoid. This is the superior belly of the omohyoid, and this forms the base or the lower border of the carotid triangle. Then we have the posterior border. The posterior border of this triangle will be formed by the anterior border of the sternocleidomastoid muscle. Then we have the anterior border of the carotid triangle formed by the posterior border of the posterior belly of the digastric muscle. So this is the anterior border of the triangle, and it is formed by the posterior border of the posterior belly of the digastric. The next one is the muscular triangle. This is also paired, which means we have one on the right and one on the left. The boundaries, the base of this triangle is formed by the anterior border of the sternocleidomastoid, but at the lower part, which means the lower part of the anterior border of the sternocleidomastoid forms the base of the muscular triangle. Then the posterior border is formed by the anterior border of the superior belly of the omohyoid. This is the superior belly of the omohyoid. This is the anterior border, this is the posterior border. So the anterior border actually forms the posterior border of the muscular triangle, while the anterior border is formed by the anterior midline plane. You can see how these triangles are formed with the digastric muscle and the omohyoid muscle creating this demarcation. So going to the content of all the subs of the anterior triangle, we already know that the anterior triangle is made up of the submental triangle, the submandibular triangle, the carotid triangle, and also the muscular triangle. For the submental triangle, this is where we say the submental triangle is bounded at the front by the chin, then posteriorly by the hyoid bone. So if you extract this space and represent it with a bigger presentation on this image, this is the mandible, this is the chin, and this is the hyoid bone. And this is the anterior belly of the digastric muscle. This is the posterior belly extending to the posterior region. So this is the anterior belly. We have one on the right and one on the left. We've said that the submental triangle is an unpaired type of triangle. So we just have one triangular space below the chin. So this is the configuration, and the content include the mylohyoid muscle. The mylohyoid muscle is a muscle that extends from the mandible down to the hyoid bone. So this highlighted in green color. And the muscle, we have one on the right and one on the left, and they are joined in the midline by the anterior midline raphe. And this is the mylohyoid muscle. Then the second is the submental vein. This is the submental vein. This is like a collection of vein around the submental region. Then we have the anterior jugular vein. The anterior jugular vein drains the anterior neck, so it descends downward. We'll still come across this anterior jugular vein during the course of this lecture when we talk about the content of the other triangle located below the submental triangle. And this is the anterior jugular vein. Then we have the submental lymph nodes. These are the submental lymph nodes. Content of the submandibular. This is the submandibular triangle. The content include the mylohyoid muscle. The mylohyoid muscle, we said that it connects the hyoid bone to the mandible. We have the mylohyoid muscle here. The mylohyoid we've described as a component of the submental triangle. So this means that part of the mylohyoid muscle extends into the submandibular triangle. And that is why you have part of it within the submandibular triangle. Also, we have the ioglossus muscle. So we have the ioglossus muscle located close to the mylohyoid muscle. So this is the mylohyoid muscle, and this is the ioglossus muscle located beside it, extending from the hyoid bone up to the tongue. Then we have the stylohyoid muscle. The stylohyoid muscle, remember when we talked about our temporal bone, we talked about the styloid process, basically for attachment of muscle. The stylohyoid muscle connects the styloid process of the temporal bone to the hyoid bone. And of course, it runs very close to the posterior belly of the digastric. This is the stylohyoid muscle. Then we have the submandibular gland. The submandibular gland is located within this triangle, and also the submandibular dot, which is also referred to as Waston's dot. And this is the submandibular gland. We also have the facial artery. The facial artery is a branch of the external carotid artery, which is seen around this region, but gives off a facial branch that extends into the submandibular region to supply the submandibular gland. So that is why the facial artery becomes part of the component of the submandibular triangle. And this is the facial artery. We also have the facial vein located close to it. We have the submental artery. The submental artery is a branch of the facial artery that supplies the submandibular gland. So as soon as this branch exits the submandibular gland, it becomes the submental artery. And of course, this is also contained within the submandibular triangle, and that is the submental artery. Then we have the hypoglossal nerve. So this is the hypoglossal nerve. The hypoglossal nerve we know originates from the medulla. From there, it runs to innervate the muscles of the tongue. It innervates both the intrinsic and the extrinsic muscle of the tongue, except the palatoglossus muscle. The hyoglossus muscle, which is one of the extrinsic muscles of the tongue, is supplied by this hypoglossal nerve. And that is why the hypoglossal nerve is found within the submandibular triangle, because we have the hyoglossus muscle located within this triangle. Content of the carotid triangle. This is the triangular space that is carved below the submandibular triangle. So we have the submandibular triangle somewhere around this region. Then we have the carotid triangle below it. And the contents include the thyrohyoid muscle. The thyrohyoid muscle connects the hyoid bone with the thyroid cartilage. And this is where it extends from. In inserting on the hyoid bone, it finds its way into the carotid triangle. So we have the thyrohyoid muscle around this region. Then the next muscle we have is hyoglossus. Hyoglossus connects the hyoid bone with the tongue. Then we have the middle constrictor muscle, which is highlighted in blue. Then we have the inferior constrictor muscle that is located below it, which is highlighted in black. The next structure that we have is the common carotid artery. So this is the common carotid artery. The common carotid artery, of course, bifurcates into the internal carotid and the external carotid, and this occur within the carotid triangle. So we have the internal carotid artery. This is the internal carotid artery going up to enter into the cranium to supply the brain tissue. Then we have the external carotid. This is the external carotid artery. And of course, we have branches of the external carotid artery that are also seen within the carotid triangle. And this include the superior thyroid artery, the lingual artery, the ascending pharyngeal artery, the facial artery, and also the occipital artery, which runs posteriorly. Then we also have the internal jugular vein. We already know that the internal jugular vein is very close to the common carotid artery. The two vessels are contained within the carotid sheath, which is located within the carotid triangle. This is the internal jugular vein. Then we have the hypoglossal nerve. Then we have the vagus nerve, seen beside the hypoglossal nerve. And that is the vagus nerve. Then we have the accessory nerve. We already said that the accessory nerve has a spinal and a cranial part. The cranial part extends upward, while the spinal branch of the accessory nerve descends downwards, and it descends within the carotid triangle before it pierces the sternocleidomastoid to enter into the posterior triangle. It also forms part of the content of the posterior triangle. Then we have the ansa cervicalis. The ansa cervicalis is like a loop that is from the cervical plexus, and this is also seen within the carotid triangle. Then we have the deep cervical lymph nodes. Content of the muscular triangle. So let's see what structures are contained within it. The first one, infrahyoid muscle, which are muscles that are located below the hyoid bone. We have the thyrohyoid. The thyrohyoid muscle connects the thyroid cartilage with the hyoid bone, and this is the thyrohyoid muscle. Then the next muscle is the sternothyroid, which connects the sternum to the thyroid cartilage. Then we also have the sternocleidomastoid, which connects the sternum and extend up to be connected onto the hyoid bone. So we have these three infrahyoid muscles contained within the muscular triangle. Then we also have the superior and the inferior thyroid artery. We already know that the superior thyroid artery is a branch of the external carotid. We have the external carotid within the carotid triangle, and some of the branches that we say are seen within the carotid triangle, one of them is the superior thyroid artery. So they extend from here to be a component of the muscular triangle to supply the upper part of the thyroid gland. Then we have the inferior thyroid artery that originates from the thyrocervical trunk, which is a branch of the subclavian artery. So they extend from a region downward before they enter into the muscular triangle. This is the superior thyroid artery. This is the inferior thyroid artery supplying the thyroid gland. We have the anterior jugular vein. We already said that the anterior jugular vein drains the anterior part of the neck. We have the anterior jugular vein being one of the structural components of the submental triangle. So as they descend down, they also extend into the muscular triangle, which is seen below the submental triangle. So we have the mental triangle up here, while we have the muscular triangle just below it. Then we have some viscerals located within the muscular triangle. We have the thyroid gland within the anterior part of the neck. We also have the parathyroid gland seen at the posterior part of the thyroid gland. We have the larynx as one of the structures contained within the muscular triangle. And distal or inferior to the larynx, we have the trachea. So the trachea also forms part of the structural component of the muscular triangle. We have the esophagus. So the esophagus can also be taken as one of the structural components of the muscular triangle. Clinical relevance. The carotid triangle, which contains the vessels of the neck. We have the common carotid artery, the internal and the external carotid artery, and some of the branches of the external carotid artery. So these vessels can be accessed during surgery, knowing the boundaries of this triangle. Also, the muscular triangle, as we've stated, contains a number of viscerals, and when the need arises, they can also be easily located within these subdivisions. We can check our understanding of this lecture through the following. Describe the boundaries of the anterior triangle. Describe the subdivisions of the anterior triangles. We've said that the anterior triangle is further subdivided into 4 sub-triangles. So we should describe these subdivisions. List the content of all the subdivisions of the anterior triangle. This we have highlighted during the course of this lecture. So thanks for watching. Let's continue to stay tuned.